Good morning, everyone. Thank you for the invitation to be a reactor in today's PDS Continuing Laser Education by the Laser Subspecialty Group. Laser is a state-of-the-art for hair removal, and it is one of the most common aesthetic procedures in the Philippines and all over the world. Today, I will share with you some tips and pearls and some commonly asked questions about laser hair removal. Does laser hair removal work best on dark hair and light skin? Generally, yes. Laser targets melanin no matter where the pigment resides. They are not smart enough to distinguish or recognize pigment in the skin or hair. So if you have less pigment in the skin and more pigment in the hair, what is important is there should be a good contrast between the two. Laser can then focus on hair and deliver energy where it is supposed to go and not worry about spreading to surrounding tissue where they may be pigments too. So with a deeper or darker skin tone, without any contrast, it might be tricky and confusing for the laser to focus on the hair and leave the background skin alone. Can any laser be used for dark skin? Not all lasers are created equal. Not all lasers are effective or safe for deeper skin tone. Some lasers may target pigments too aggressively and thus may be dangerous to be used in a darker skin tone. Use conservative or less aggressive settings because of the risk of targeting skin instead of the hair, although eventually it may take more sessions to achieve our end goals. What is then the recommended laser for darker skin tones? There is no single best laser, but for Fitzpatrick type 5 or 6, long pulse and diag is recommended. Why do some patients get darker skin after laser? This is post-inflammatory hyperpigmentation. It can happen to anyone, but the darker the skin tone, the greater the risk for this. The inflammation from laser causes more production of melanin, thus producing possible hyperpigmentation, which can be temporary or may last longer in some patients. Thus, our post-laser instruction should include avoidance of the sun to avoid post-inflammatory hyperpigmentation. Does laser work on blondes and redheads? The answer is very slim to none. Laser for the hair is engineered to target melanin. So essentially, if you don't have pigment in your hair, then the result is very unsatisfactory. Melanin, which is also present in the blondes and redhead, is called pheomelanin, which is a lighter type of melanin. And in comparison, we have eumelanin, which is dark brown or black pigment. Which laser is painless? Pain is very personal and very subjective. We can use the same machine and the same setting for two different people and may get two totally different reactions. One may be wincing, for the other one it's like a walk in the park, asking if the procedure has yet to start. It is unlikely to have a laser without some degree of discomfort, like a light rubber band snapping. Of course, we can do something to minimize discomfort, like applying topical anesthesia. Most machines are with cooling system to protect the skin and make the procedure very tolerable for the patient. It is unrealistic to expect laser to be totally painless. What is paradoxical hypertrichosis? It is increased hair growth after laser hair removal, and it is usually seen in Asian, Mediterranean, and Hispanic background. Can we do laser in pregnancy? Technically, yes, but personally, I won't recommend doing a cosmetic procedure to a pregnant patient. Can you do laser in areas where you are applying an active ingredient, like for example, retinol? The answer is yes. Just the same, always ask patients to disclose skincare regimen and medication. What medication should you avoid while having laser hair treatment? I cannot think of any medication that we should avoid while having laser hair treatment. Many are asking this question because they are thinking of photosensitizing medications or oral medications that make you sensitive to sunlight exposure. Remember, the wavelength of laser used for hair is very much different from wavelength of ultraviolet radiation. Ultraviolet is multiple wavelength traveling in different direction, while laser is a single wavelength traveling in sync with one another in a single direction. Can I have a laser if I am a keloid former? Yes, but remember, if you will get complications like blister or burn, there is always a possibility of developing keloid in that area. So how many times do I need to have laser treatment for hair not to come back anymore? After a series of treatments done, the usual expectation is that they will not grow hair in that area ever again. That is not true. This is the US FDA definition of permanent hair removal. It is the long-term, stable reduction in the number of hair regrowing after a treatment regimen, and does not necessarily imply the elimination of all hair in the treatment area. This is the biggest criticism of laser hair removal. Very complex and very much affected by hormones, aging process, stress, and even if a follicle has been treated by laser, the hair follicle retains the ability to regrow hair. If you have a series of treatment and you get to a point where you are not seeing much decrease in growth, that is a good point to stop and realize this is the most that one can get based on his or her biology and body. Most people will require 1 or 2 treatments every year to maintain that hair reduction. Maintenance is usually necessary. Can hair come back with pregnancy hormones? Yes. Anytime you have big shifts in hormone like pregnancy, menopause, taking birth control pills, this can also lead to shifts in hair growth. Does laser hair protect from acne? No. You may mistake folliculitis for acne. Laser helps with folliculitis due to the irritation you get if you are shaving. Before treatment, shave in advance 1 or 2 days before, because we want stubbles or short hair only. Otherwise, there will be a wastage of energy just targeting the shaft instead of going to the hair root. I hope you learned a thing or two from my reaction to this case. Thank you for your attention. Good day, everyone.